Today we'll discuss about glass ionomer cement. If you see the definition of glass ionomer, it is a cement which is a substance that hardens to act like a base, liner, filling material or adhesive to bind devices or processes to the tooth structure or to each other. It has been taken from the Phillips Science of Dental Materials with its ADA specification number of 96. If you see, the other names of GIC is like dentin substitute, man-made dentin, artificial dentin, and aluminosilicate polyacrylic acid, that is ASPA. Coming to the composition of the GIC, the powder contains calcium aluminosilicate containing fluoride. In that we have silicon oxide, aluminum oxide, aluminum fluoride and calcium fluoride with sodium fluoride and aluminum phosphorus. If you see the liquid composition of it, it has mainly the water and the itaconic and the malic acid with tricarboxylic acid. Coming to the classification of the GIC, based on the use, it is type 1 is luting cement, type 2 is restorative, with the type 3 it is a liner and baser, type 4 is used for pit and fissure, type 5 is luting for orthodontic purposes, type 6 is for core build-up material, and type 7 is high fluoride releasing command set with a type 8 of atraumatic restorative treatment, and type 9 is pediatric GIC. See, this is based on its use. If you see the setting reaction of the GIC, it is a 3-step procedure in which the dissolution is the first step. That is, here there would be beginning of the reaction of this surface of the glass particles is attacked by the polyacid, which results in a dissolution of the surface glass particles releasing calcium and aluminum ions, and there would be formation of the cement salt. Next phase we see is the precipitation of the salts, that is gelation and hardening. In this stage, the calcium and aluminum ions bind to the polycarboxylate groups, and the initial clinical set is due to the cross-linking of the more readily available calcium ions. And here the maturation occurs over the next 24 hours when the aluminum ions get bonded with the tough cement matrix to form a more rigid cross-linking agent. And if you see, they would be the sodium and fluoride ions do not participate in this cross-linking of the cement, and this unreacted portions of this glass particles are sheeted by the silicate glass. And the hydration of the salts occurs. That is, during the maturation phase, there is a progressive hydration of the matrix salts, which leads to the sharp improvements in the physical properties of the cement. That's how the setting reaction occurs in the GIC. Now we'll see the setting time for the type 1 GIC, which is about 55 to 7 minutes, whereas for the type 2 it is 10 minutes. And the consistency and the film thickness is about it should not be exceeding 20 micrometers for the luting agents, and it is similar to the or more or less than the zinc phosphate cement, and it is suitable for the cementation purpose. Coming to the resin coating and protection of the cement, this can be done using the petroleum jelly, cocoa butter, waterproof varnishes, and even the nail varnishes. These all helps in decontamination of the water and dehydration during the initial stages setting stages, which can compromise the physical properties of the restoration. That's how we can prevent the water contamination and dehydration of this setting cement. Now we'll see the properties of the GIC. If you observe the property of the GIC, it is the first is the wear and fatigue. It is nothing but, in general terms, the wear is nothing but deterioration. So this marginal breakdown occurs due to the cyclic loading during the mastication procedures. So, this cyclic loading may occur due to the failure of the mechanisms and thus may lead to the void nucleation, crack propagation, and detachment of the particles by suddenly from the set cement. Okay. Next, we'll see about the other property, that is the thermal compatibility. If you observe the thermal compatibility, expand upon by heating by hot foods and beverages and contract when exposed to the cool substances. Now we will see the anti-karyogenic properties of this GIC. The first property is the fluoride. The property which is present in the GIC and it is effective in case of caries prevention. Okay. This caries can be prevented due to the presence of it. And if you see, this GIC is also known as the smart restorative material because apart from releasing fluoride to the surrounding tooth structure, they can also recharge themselves by fluoride. That's the reason they are also referred to the reservoir effect. That's how it is also known as the smart restorative material. And if you observe this property, how it acts is because the fluoride ions leaches out from the GIC into the tooth when it is placed in the cavity. Then there would be balance of the fluoride between the tooth and the restoration. Later on, this fluoride enters into the saliva and both the tooth and restoration are short of the fluoride. Then, topically, if you apply the fluoride, it helps in replenishing the cement. That's how this fluoride reservoir effect works. And now, we can even observe the aesthetic property of the GIC. Aesthetics, if you see, it is depending upon the three questions. One is the refractive index of the GIC, that is the glass particles which are present in the GIC, and also the matrix, and also the particle size of the GIC with its translucency of the glass particles. If you see the enamel, the refractive index of the enamel, it is more because of its high percentage of inorganic content, and bonding of the GIC to the enamel is also stronger than the dentin. And coming to the conditioning of the tooth, the conditioning of the tooth helps in removal of the smear layer. That's how the smear layer property, if it is removed, then there would be more bond between the tooth and the restorative material. And if you see, it also increases the surface energy, which further increases the bonding between the tooth and the restorative material. Next property is the marginal adaptation and the leakage. The quotient of the thermal expansion of the glass ionomer cement is about 0.8, that is similar to that of tooth structure. That's the reason it has good marginal adaptation when compared to the other cements. And the other property is the radio opacity. It is more radiolucent because of the silver and the heavy metal salts present in the GIC. Next property is the biocompatibility because of its fluoride releasing ability and also because of the no secondary caries due to the fluoride release, which helps in increasing the marginal seal, and also it is a bioactive material. That's the reason it's more biocompatible. If you see the indications of it, it is mostly useful for the sealing of the pit fissure and also for the class 3, class 4, as well as the cervical lesions. It helps in sealing the cervical regions due to the biocompatibility, and also has a base or the liner under the cements, and also for the root caries property. If you see the atraumatic restorative treatment, This atraumatic restorative treatment, if there is a tooth with a carious lesion, then with the use of the hand instrument, this caries can be excavated with a spoon excavator. Later on, the GIC can be placed into the excavated cavity, and it helps in the other instrument. With the hand instrument, we can directly place the instrument and manipulate the GIC. Now we'll see the sandwich technique. In this, if you see, there is a GIC. On top of it, we can see the composite resin has been placed. This GIC helps in release of the fluoride. That's how there would be no secondary caries formation after the placement of the GIC under the composite, and it is resistant to the micro leakage. Because of this property, this sandwich technique helps in preventing the secondary caries. If you observe the tunnel preparation, this tunnel preparation helps in the prevention of the caries and also helps in the proper sealing due to the enamel has been preserved. If you see the modifications of the GIC, the first one is the miracle mix or the silver cement. Here, it contains the powder and liquid with GIC and the metal particles. It is a physical blend of the silver alloys with a glass powder in a 1:7 ratio with a liquid component of the GIC. That's how it helps in increasing the strength and also the abrasion resistance. Next cement is the cermet cement. If you observe the cermet cement also has the better abrasion resistant and high flexural strength because of its the powder and the liquid property, that is a fusion of the glass ionomer to the metal powder like silver or gold through the sintering, that is through a temperature of 800 degrees centigrade. Okay. Now we'll see about the most important and recent modification of the GIC, that is a resin modified GIC. If you observe the resin modified GIC, it can be defined as an hybrid cement that sets through an acid-base reaction and partly through a photochemical polymerization reaction. Example would be the Fusy to LC Vetri bond or the photofill or Vetrimer. Fusy 5. These all are commercially available. If you see the powder property of the resin modified GIC component, that it has the fluoroaluminosilicate glass particles, whereas the liquid component contains the water polyacrylic acid with the HEMA monomers. That's how the blending of the two with the ratio of 3:1 helps in easy mixing. Coming to the setting reaction, it is a tricure reaction with acid-base neutralization and also due to the release of the free radicals, that is methacrylate cure. And if you see the mechanism of it, if you observe the mechanism also, there is a cross-linking of the methacrylate groups due to the chemical initiators in the powder, and also there would be acid-base reaction between the glass and the polyacrylic acid running simultaneously. So, on exposure to the chemical initiators in the powder, so this rapid cross-linking the HEMA as well as this methacrylate groups of the polymer due to the photoinitiators are present in the powder. This will bring about the command set of the material. So over the next few days or the weeks, both the chemical reactions continue till the stable structure is obtained. If you observe the setting time of it, it is about the 6 to 8 minutes of the GIC. So the RMJIC shows the combined advantage of the both the composite as well as the glass ionomers, and it is more superior when compared to the conventional GIC. So this is brief about the GIC, that is a glass ionomer cement, which is most used clinically as a restorative and the lining material.